We are live. The panel from today with Lotus Blossom Clinic and the Spoonful Experiences Telesummit, part 2 of a 4-part series. You have found the panel of the participants from the practitioners from our previous video that you were just watching. So welcome as you find your way here. We'll give folks a second to get here. And then just say, we are so delighted to be here. I have 5 amazing practitioners with me here today. Myself and, we lost Vicki. No, we've got everybody here. Okay, good. Dr. David Martine, he's a doctor of Oriental medicine. He's an acupuncture physician, licensed in both Florida and Colorado. Vicki Gilardi is a medicinal food consultant working with Dr. David Martine at the clinic. Jenny Lee Kiccioni is a certified EFT, emotional freedom technique practitioner, and a joyful journey coach. And Phyllis Brooks-Leitzis. Phyllis has a master's in social work, and she's a licensed social worker as well. And she's certified international deep imagery practitioner and trainer. So I'm going to go around to each one of these beautiful practitioners and have them say just a little more information about themselves. Let's go ahead and start with Dr. David. Let's see.
I'm unmuted. Okay. Hello, everybody. I think the talk today was going to be about some acupuncture points. I've been doing this work for 23 years now, and moved to Florida about 12 years ago. And it's been a great practice here, and we hope that we can educate you and entertain you a bit today.
Great. Thank you, Dr. David, and welcome. Next, let's move to Vicki Gilardi right next to him there on the screen. Vicki, welcome. Oops, let's unmute Vicki. Hold on. There we go. Okay, Vicki, go ahead.
Hello there. I'm a food consultant, and I'm doing this for decades. I love what I do. I've been with the clinic 6 years, and that's really stepped up what I do. It's a learning experience every day with our patients and with the research that we do. So I'm very happy to be here, and I'm happy to do what I do. And working with Dr. David is a pleasure.
Great, thank you. Welcome, Vicki. Okay, moving to Jenny Lee Kiccioni, or Ciccone, I should say.
Okay, let me unmute myself. Can you hear me now?
Yes.
Hi, everybody. I'm so honored and excited to be here and have the full passion to support people for their emotional freedom, because their freedom in life starts from the emotional internal freedom first. I, went through my transformation, seeing a lot of stuckness or so. It's because of the out of the alignment. So I'm here. Thank you to share.
And welcome, Jenny. And Fee, let's unmute you and hear a little bit from you as well.
Hi, thanks, Deb. I'm also delighted to be here today with both the other panelists and also everybody who's listening. You can call me Fee. As Deb said, I'm a licensed clinical therapist for over 20 years, certified in hypnosis and Reiki and deep imagery. I now offer deep imagery individual sessions, workshops, and training for other healing professionals. And I do that either online or in person. In person, I'm available at Lotus Blossom. Thank you.
Great, thank you, Fee. Well, I wanted to start today's panel off with a general question, which I will refer first to Dr. Martine, and then apparently to our little doggy, who I should put away next time. So Dr. David, I'm going to mute myself after I turn it over to you. So carry the ball for a moment and I'll go take care of the dog. But the question is this: what makes natural medicine effective?
Okay, thank you. Natural medicine has been effective since forever, actually. Before there was all this Western allopathic medicine, people took care of themselves, they took care of each other without all that. So natural medicine is the first medicine. And of course, Chinese medicine has been around for centuries, and it's a natural medicine. They started with, acupuncture and herbs and herbal formulas that have been around for 1,000 years easily. And, of course, the books have been around 1,000 years, but they had them before that. So natural medicine is effective because it is our basic medicine. And are you back, Deb?
Yes, I'm back now. So let's, is there anyone else? Perhaps Vicki, would you like to respond to that question too? What makes a natural medicine effective? Let's see, Vicki, I'll unmute you. There you go. Now you're unmuted. There we go.
Okay, again, like Dr. David said, it's been around for thousands of years. So if it's been used these herbs and supplements, you might call them, if it's been used for thousands of years and it's still being used, that itself tells us that it must be effective. People wouldn't be taking certain herbs unless they did see some kind of response. But also what makes it so effective is when I have work with clients, I tell them to follow the protocol that Dr. David and I put together. And if you're consistent and you follow the protocol with the natural medicine, with the herbs, with the supplements, with certain diet, then that's what will work for you. So following the protocol is really very, very important. That's what makes natural medicine effective, along with the long term that it's been here.
Great. Well, thank you, Vicki. And, we all know that there's some basic about these lifestyle considerations that are just a good thing for us to be aware of as well, and will guide us in a good direction toward even the better things that can be offered by professionals, such as are here on this panel. So let's see, what about Jenny Kichoni? Could you say a bit about what your impression is, what makes natural medicine effective?
Oh, yes, sure. I'd love to share. I found, because I worked in the corporate before, seeing many people, experiencing stress-related symptoms or so, and they try to figure things out and fix them, fix the body issues, relationship triggers. But I went through my own transformation and came out and really experienced this with this tool and found our body is so intelligent. Instead of fixing them, we probably need to shift around, turning to honoring our body, because our body is intelligent and the physical symptoms are really telling us some messages somewhere in our body at different levels, physically, mentally, emotionally, and also spiritually. They had some misalignment there. So they are the messages. If we could use these tools to just honor and allow ourselves to give the healthy outlets to those feelings and thoughts which carry energies, and then they could go, we'll be back to the alignment, and then the symptoms, migraine, asthma, shortness, breathlessness, breath, it's just disappear and gone gradually. So I have so much passion to share these natural medicine. Our body can heal. It's simple with some, a lot of tools out there. EFT is one of them. Thank you.
Very good. Thank you, Jenny. Now, Fee, what would you add to this conversation about what makes natural medicine effective?
I would follow up on what Jenny said too, considering that's the natural alignment. The human body is quite amazing. All of our organs, systems, and structures are all interconnected and related to all of our energy centers, our chakras. In the natural medicine, we focus, therefore, on the whole body, the whole person, and the framework of body, mind, and spirit, rather than in modern medicine or conventional medicine, they focus on suppressing a symptom or a pain, simply. And as Jenny said, that symptom leads us to something else because it's all interrelated. So natural medicine works in alignment with our body's natural ability to heal itself.
Well said, Fee. And sometimes the suppression of a symptom may be required. We also do here on this panel believe that there are integrative medicine uses where both Eastern and Western medicines, natural and modern medicine, are used in conjunction with one another. However, I think I can speak for everyone here. We know that the underlying conditions are often best addressed through natural means because we have evolved with all of these abilities within our body, mind, and spirit to be able to live a good life, a healthy life, a radiant life. We just need to find our way to what works for each one of us. So speaking of the pain that sometimes is in the world, why do people come to see you at the clinic, Dr. David? What kinds of things bring them to this ancient art and medicine of acupuncture?
I think that the biggest motivator is pain. When people have pain, it motivates them to do something about it. Especially men, they tend to lie to themselves, "Oh, it'll go away" or something. But pain tends to motivate people to make a change. So I see a lot of people in pain, from every pain, back pain, neck pain, head pain, hand pain. And so that's the biggest thing that makes people move and make a change. Usually it's because they've been to maybe 10, 11 doctors and not gotten the answer they wanted. Or it's because they have been to Western medicine and they find out that they don't want to take any more of the opiates, or they want a different answer than the pills. And so that motivates a lot of people to come see me. A lot of people come for anxiety and stress, and a lot of drugs are used there too, which can be helpful. But for some people, it does interferes with their thinking, and they really want to try something different. And so one of the things that acupuncture is well known for is helping with anxiety and stress.
Mm-hmm. Okay, great. Thank you very much. And what brings people to you? Any of the rest of you that want to speak for a moment? Who would like to speak? How about Vicki? Okay. Let's have Fee first, and then we'll go with Vicki.
Okay. Deep soul imagery, not many people have heard of it around here. It's much more familiar in Europe. So someone has to be pretty adventuresome to try it. But I think when someone really wants to expand both their spirituality, their connection with their center, and touch base with their soul and their whole body, that's when they're willing, that's when they'd like to come. Also, other healers who hear about it and try it are just blown away by the remarkable healing that it offers, even in just one session.
Okay, great. Thank you very much, Fee. And Vicki, what were you going to add?
People come to me for help with various diseases: cancer, autoimmune, diabetes, weight control, allergies. We see just a large variety of different diseases. Most of my clients don't want to take Western medicine, and they have taken it and they haven't responded well to it. So I help them, in putting them on the right diet that's going to fit them and help with their particular disease, like diabetes. It's a low sugar diet, low carbohydrate diet. I follow them along. There are certain supplements they take, certain smoothies in the morning that they need to take. And I have had clients that have been turned around completely with diabetes, that have had a blood score of 399, when a doctor couldn't help him at all. And he went on a protocol that we put him on. And in 4 days, he called me and he said, my blood sugar is 121. So that was a big, drastic difference. So that's what I do. And that's my joy when I see something like that. But I also have a very compliant client who follows the protocol.
Right. So what I understand that you do, because I do it also with Dr. David, is we meet with the doctor and this person who's a patient of the clinic of Dr. David, and then we spend some additional time with them after Dr. David has gotten together with us, and we, with his blessing, there is a plan, an idea of giving them dietary guidance, and then some of the supplements, of course, that we have. Boy, you know, it's a powerful team that we have really to help people. And Vicki, what people may not always realize when you're saying those numbers about the blood sugar level,
Yeah.
whoa, you know, he could have a heart attack any moment, right? He could have a stroke. He could, there's so many things that could happen. He was on a very hairy edge of something. And I believe this person was in his 50s, right?
In his 50s. And what happens is with the diabetic medications, that's what causes eventually the heart disease. It's very hard on the arteries. And then, you know, inevitably, you see an older gentleman with diabetes, he also has heart disease.
Mhm.
So it's best to get off the medications. Type 2 diabetes is 100% food related.
Yeah.
So if you can get off the wrong foods and on the right foods, hopefully you won't have to take medication for the rest of your life. And that'll save your arteries and your heart.
Mm-hmm, mm-hmm. And more, your legs, your feet, your...
Yeah, I've seen them, toes amputated, feet amputated. It's just so unfortunate.
Yeah, yeah. Well, it's a good thing that those people who are watching this have an opportunity to look for some options in the natural world that are offered here. And each one of you offers something unique and beautiful to the world. So I'm just going to ask a question now of Jenny Lee. Jenny, would you tell us, how do you do EFT tapping to heal physical symptoms and other issues? Can you give an example?
Oh, yes, sure. Thank you for mentioning this. Because EFT tapping, when we do it, we just use 2 to 3 fingers tapping on the meridian points, totally only 9. It's very simple, but silly looking at the beginning. For some people have skeptical mind about this, but it's proved even from Harvard Medical University that those meridian points, Dr. David, you know, and are the ones who could connect us with our feelings and thoughts that happen in our emotional mind, subconscious mind, but not just the head, the physical head part. So people usually come to me when they cannot figure things out anymore because they use their logical mind, head, you know, to try to figure it out, but cannot. Give an example lately in this under this crazy pandemic situation. One lady who suddenly developed a phobia. She never had that before, fear of flying. And she had asthma attack, headaches, shortness of breath. Usually she was okay. But now she could not just push it away, shake it off. So we started using these tapping, like, you know, I am trapped in these feelings and I don't like it. I want to push it away, but nowhere to push. It's inside of me. So this shortness of breath in my chest, the headaches or whatever, when we start, she said, oh, I feel the fear of flying because I feel like I'm going to die. You know, something unpredictable could happen. And then keep going. This world is not a safe place for me. And now she said suddenly an event happened like back to 3 to 4 years old when her parents I got permission to share her story, by the way, here. The parents went through some tough time, had panic attack or so those kind of feelings. But as a sensitive girl, she passively, naturally absorbed those energies, feelings, and felt the same fear, but it's like unpredictable fear, and something bad's gonna happen. And had no idea that it was even there. And now, with these kind of global energy I shared in my video, she got triggered, and those layers, deep buried layers of fear, now it's floated up and showing up. That's why she felt losing control, everything. Now we helped her to connect those childhood feeling, fear for whatever feeling, and help her using the tapping to release it. Speak it out. Just release it. Be real. Freely express herself and let these stuck energies go. And after a minute, this event, when she see it, look at this again. She felt like, oh, I'm outside now. I'm not in this movie being the person anymore. I feel like, I have the distance, and it keeps distant far away. Now she's okay. She said she needed to visit her family this time. She can do it now. So that's, a lot of these kind of, cases, headaches.
That's a great story. That's a great story. Thank you, Jenny. And I bet, moving up over to Fee for a moment, I bet that there's some stories here with Fee too. And I first want to know, Fee, if someone asks you, well, I've heard of guided imagery. How is deep imagery different from guided imagery? What would you say to that?
Sure. Guided imagery, which is a modality that people use, you are instructed to see certain things or to do certain things. For example, if I said to you, picture that you're holding out your hand and picture a red apple in your hand, you could do that. That is instructing you to see something. If I said, imagine that you're walking along a path in the woods, I am instructing you to do something. In deep soul imagery, or deep imagery, as I call it sometimes, the images that appear, they're spontaneous images that appear in the mind of the journeyer from a deep soul level, and they do bring healing and wholeness with them. It's a very different process. It's more organic, authentic, and unique to the person who's doing it rather than the practitioner. That's what I'd say the difference is.
Okay.
I do use guided imagery in the beginning of our sessions, like they would use it in Hatha Yoga, just to help people relax, get out of their mind and down into their body. Mm-hmm. Once we're there, then the magic starts.
Awesome.
Yes, I do have, there's a lot of remarkable stories about the healing that deep imagery offers, including my own story of healing. But I'll share with you a gentleman's story who in his outer life appeared successful, but carried internally a lot of angst, a lot of anxiety. He was born in if I'm looking back, he was born in a European country during wartime. When he was just barely a toddler, his family had to escape. Their name was on the list to go to a death camp. He had to escape the country, and they one night took a fishing boat over to Germany. Their family stayed with a family in Germany for a while, and then they lived for several years in a displaced persons camp. When he finally came over to America, he started the first grade, knowing no English, and wearing lederhosen. He was embarrassed, ashamed for not dressing like the other children. His mother was divorced, so his father was not involved in the family scene. And so when Boy Scouts would come up and there'd be father-son activities, he felt like he never belonged. He always struggled with that belonging his whole life. At the age of 9, when his mother would have a gathering, a social gathering, he'd go around afterwards and finish all the drinks and all the glasses. And eventually in his 20s and 30s, he started drinking 2 or 3 drinks a night. When he came in to do deep soul imagery, we focused in on his heart chakra. And he was amazed when this massive buffalo appeared. And he allowed himself to get to a very deep state of relaxation before this. And he could actually see the fur around the buffalo's neck. And when I had him merge with the buffalo, become one with it, he just was amazed that he could feel how strong the buffalo was and how grounded the buffalo's hoofs were in the earth. And he said he could actually smell his buffalo fur in the bright sunlight. He turning with buffalo to join the rest of the herd brought tears to his eyes as he felt like he was part of the herd. He belonged.
Wow.
Later, he shared that something happened on a cellular level for him during that one session. It was pivotal in his life, and the rest of his life changed totally. About a week later, he decided that he would go to his first AA meeting, where he, from there on, for the rest of his life, stayed sober and was very active with AA. Later, he was able to meet a woman, marry, and have a family. And he was beside himself in the fact that he could allow himself to feel like he belonged, like he was part of that family. That is some of the work that deep soul imagery does for people.
Wow. Fee, that's an amazing and powerful story. 2 powerful stories, both from these 2 ladies, Jenny and Fee, who work with people to get past that conscious mind, to work at deeper levels, to unveil and uncover and become more of who they can be. I want to bring a question out from the audience right now to Dr. David first, and then if anyone else wants to respond. This is from Marty. He says, can Eastern and Western medicine mesh? Now, I answered that question a little bit, but is there anything more you would say?
Yes. The Western medicine is wonderful medicine. It's good to have both, though. There's doctors in town that I work with that they refer to me. I refer to them, especially with fertility and things like that. So, and we welcome working with any Western doctor that wants to work with us. So, I think it meshes pretty well. There's wonderful things that Western medicine can do, and we definitely need to include that in our choices when we're talking about medicine.
Yes, and you work at the Cancer Center, the Lee Health Regional Cancer Center, and obviously that is joint medicine, that is integrative medicine, and you're fulfilling a particular role there. We at the clinic will work beyond that, also with the natural side to support in other ways. And everyone has these choices, and sometimes they are difficult choices. A lot of times there's a great deal of fear. And so there are ways at the clinic for you to work with someone on all of these different levels to find your best you. Now, I've got another question here that I think we've answered this one. This was from Karen Carvalho. She said, how do you do deep soul? And I think, Karen, we have answered your question. If not, we will make sure that everyone's contact information is at the bottom of this post a few minutes after we close up.
And thank her for the question. I really do appreciate it.
Yeah. And then there's a question for Vicki. Let me unmute you, Vicki. And this one is Lynn Sullivan wants to know, do you offer a free consultation?
Normally I don't, Lynn, but today, since I was going to give away a free consultation, and since you asked the question, I will give you a free consultation. I'd be happy to.
Awesome. Okay, very good. Well, we're getting some great questions here, and yeah, that's those are the ones I'm. For now, I think we've answered quite a few. And as we look to wrap up today, because we had a nice conversation here, I just want to ask one more question about needles, because this is such a big one for people. I see big strapping men who will go do surgery simply because they're afraid of coming to do needles. And Dr. David, what would you say to that fear of these small, tiny needles?
Well, it's hard to address a fear because they're irrational. The needles we use are so tiny and small that people hardly even notice them. Many times I have to wake people up because they're so relaxed they go to sleep. So there's really nothing to fear, but fear is not always rational, so it's hard to say what to do with it. Oh, Vicki.
Okay, hold on, Vicki. Let me get there. You go. Okay, Vicki.
I'd like to respond. Dr. David is my doctor. He treats me for back pain, for sinus, for colds, for stress, for sadness, and I don't feel the needles at all, number one. Number two, I always have a late appointment because I have to go home and go to sleep afterwards. I'm so relaxed and I feel so much better. Thank you, Dr. David. And I'm doing this a long time with him.
Very good. Thank you, Vicki. And I bet the other two ladies would have something quick to say on that. So Jenny, let's go to you for just a moment. What would you say to someone who's got a fear? Can you handle that just real briefly?
Oh, yeah. Fear of...
Like the phobia you just mentioned.
Oh,
Right?
yeah. Okay, yeah. So, yeah, I thank you for raising this question. Actually, when I do things, the initial step is to support many people to deal with their fear of confronting their fear. It's almost like I'm afraid that I will be afraid, something like that. Thinking about fear, I'm already anxious. So that's the thing. But when we do this in a natural way with my work, it's just speak it out. The truth. I am scared. I don't want to confront my feelings. It's too much. And I'm afraid it will be flooding, that I will lose control. I cannot lose control. There are so many things on my plate in my daily life. I need to organize, put things together, but I'm losing control. The fear. Just speak out all these true self-talk inside. People sometimes, we just push, and then we forgot to hear, to honor our inner voice here and just speak it out. Just like, honey, it's okay. You can speak out. You can feel scared. I'm here with you. Something like that. Treating our fear like a little baby. So then they will feel heard, honored, supported, loved.
Right.
So then it's aligned. Then they are going, actually.
Yeah. And Jenny, that's beautiful that you actually showed them some of the tapping as well. And you are using the Chinese meridians there. You're utilizing other facets that are beyond the conscious mind. And it's beautiful that this all comes together. Fee, what would you add about dealing with fear?
I'd like to talk about the fear of the needles. One of the reasons that I became a social worker is I was deadly afraid of needles and blood. So I didn't want to be a nurse. So, and when I went to Dr. David, I had a sinus problem that I've had for several weeks, couldn't get rid of. And the thought of having needles right near my eyes and stuff, I did not feel them. Dr. David is very good at this, and it's a snap, really, honestly.
It is. And you know, one of the things that struck me years ago, we were at a conference and it was an integrative medicine panel from, I believe, Johns Hopkins University Medicine. There were 4 acupuncturists and 4 surgeons. And they went through this whole panel discussion about which is better, which to use in which case. The upshot of it was 80% of the time, they all agreed acupuncture should be used first because 80% of the time it can handle it. Now, that means that 20% of the time there was something physical that still needed to have a surgery. And so they, as an integrative team, would make that sort of determination and help guide someone in the best ways to do this. Therefore, my opinion is try acupuncture first. It's non-invasive, practically no pain. For many people, no pain, all relaxation. It starts the body's healing mechanisms in ways that are amazing, how the energy flows through the body. So these are amazing things and practitioners that we all have here with us today. And I want to ask a final question of each one of you. And I'm going to start first with Dr. David, and then go around to Vicki, Jenny, and Fee, and ask you this. Is there anything that you offer that's special, or any final comments that you have? Any special offers, final comments? Dr. David, hold on, let's unmute you. There we go. Now, hold on.
I got it.
Okay.
Special offer. I hadn't done this special offer, but I think since people are out there listening and we were trying to expand our telemedicine work, how about offering a free acupuncture visit?
Great idea. Great idea. Okay. And how can they do that? Where do they call, or what do they do?
Well, since they can't sign up a sheet and put it in a jar, I don't know how we do that.
Okay, how about I suggest that the first person who in this stream says they would love to come in for a free acupuncture session, that they get it. What do you say?
Fine.
All right, so let's see who types the fastest. Okay, over to you, Vicki. Any special offers that you have? I believe you've already said.
I already did. I'm happy to do a free consultation for that lovely lady. And what was the rest of your question, Deb?
Anything else about how to contact you?
You can contact me directly at 239-292-2037. So you can contact me anytime, and I'm happy to talk to you, answer some questions, maybe come into the clinic.
Very good. All right, thank you, Vicki. Then over to Jenny, and I'm Jenny. I'm unmuting you. You should be, no, it's still not unmuted. Okay, I guess you'll have to do it, Jenny.
Okay.
There you go.
Now? Okay, yes. Yeah, thank you for that. I do love to welcome you if you feel resonated with what I share in my work. I have a Soulful Women's Joyful Circle. It's a free circle for you to come to connect, gather, and experiencing the releasing and shifting, so that you understand the bridge relationship between your calmed mind and your body symptoms, and release it and feel better, improve energy. And also happen to, be this timing. And June 10th, I have a 7-day online EFT mini retreat. So it's a good timing for you also to come and learn and experience.
Okay, Jenny, you're fading out a little bit. So it's a 7-day EFT, and it's online
EFT, 7-day online EFT mini retreat called Calming Mind for Body Rejuvenation.
Okay, great. And you'll put your contact information down at the bottom. I believe you had said some in your video as well. So thank you. Thank you, Jenny.
Oh, of course. Thank you.
Vee, any last words, and what is a special or a way to contact you?
Sure. I'd love to talk to anyone further about deep soul imagery. I think it could be used in so many ways in someone's life. I'm offering for the month of June a a reduced price of $40 a session. And I would love to have people make use of that. Also, whoever types in or calls in today, I would offer a free introductory session, either online or in person at Lotus Blossom. So love to hear from you.
Very good. Thank you, Fee.
Add a comment to some of this here.
Yes, David?
I'd like to add a comment. One of the things that I think with any, especially with natural medicine that we have, is a big advantage is, well, many times I'll have a patient come in and their problem won't be physical. It won't be something this you could take a pill for, that you can have a surgery for, that even acupuncture may not help. But because the problem is in their spiritual side, you know, and a lot of people think that's kind of woo-woo, but I've seen so many times where changing your vision, changing your spirit, changing your thinking, that Jenny and Fee could help you do. I mean, that oftentimes is the key to begin any kind of a healing.
Oh, yeah.
I wanted to make sure.
Okay, great. Thank you.
I'm sorry. I highly, agree with Dr. David. These kind of thing at different levels, work together. It's just amazing. Much, much faster, speedy up, of the recovery. And sometimes as a supplement for, with Western medical treatment, also like cancer, breast cancer, also everything. Yes.
Okay, great. Thank you. Oh, and also one other thing regarding the free consultations. Dr. David, you do a free consultation for anyone, anytime, right?
That's right. It's just a standard part of the business.
Okay. So new patients often come to you just with their questions. They're not sure what your kind of medicine might be able to do for them. And we have a winner for yours, Dr. David. Guess who? She's going to come in twice. This lady, Lynn, you are fast on the trigger there. So we'll be in touch with you for sure. And also, she'd like to come see you, Fee. So everybody's going to be pretty happy with that. And I just want to say again, thank you for attending, give you a little information about what's coming. Oh, Fee, did you want to say something again? You're muted.
There. I just wanted to say that anyone who wanted to reach me could reach me through my website, www.phyllisbrooksdeepimagery.com.
Okay.
Okay.
Good. And we will put in the comments section beneath this video in the next few minutes, you'll start to see each of these practitioners entering their contact information so you can find them later. And next week, we have a brand new crew of people. Well, actually, some of them are on here already. Vicki, David, and I in particular will be on with Food is Medicine next week. That's May 31st at 1 o'clock Eastern Time. And if you missed the videos from today's part 2 of our 4-part Spoonful Telesummit, you can find it on YouTube. Okay, so it's Spoonful Experiences, Holistic and Natural. And you can also find that on our Facebook page as well. So I'm going to say signing off. Any final words from anyone? Okay, Vicki, hold on. Let me unmute you. There we go. You're on.
Oh, I just wanted to mention what we also have at the clinic. We have food classes. We try to have them regularly, like monthly or every other month, and they're very informative. The next one isn't scheduled yet, but if you would like to attend one of them, just call the clinic and they'll put your name down. And what we feed you, you'll get natural food. And it's usually held on a Saturday or a Sunday. It's about 3 hours, and everyone seems to enjoy it immensely, and we'd love to see you. And Deb and I and David, we are like the 3 Musketeers, and we answer questions and help you. It's an intimate group. It's usually maybe 6 to 10. It's going to be intimate right now anyway. But we would love to have you. If you're interested, just give the clinic a call and give them your name.
And thank you, Vicki. And for those who are concerned, because we certainly have been, we have some fairly stringent procedures. Dr. David, did you want to talk a little bit about that in terms of keeping people safe in these days?
Yes. I guess I'm not muted. We make sure that people, certainly don't have a temperature. That's not a great screen, but it's a screen. In our areas, we wear masks. We make sure everything is wiped down and cleaned after every patient. We deal with the doorknobs and the handles and the toilet handles and everything. And just try and practice good hand washing and have our patients come in. So if you're sick, we don't want you in, because we are not ready to treat COVID patients. But expect that you may have to wash your hands, that you will have to follow some protocol when you get here.
Right, and we ask everyone to wear masks in any of the common areas. And Dr. David, what about those HEPA filters? What are those about?
Yeah, I saw this, and I've got medical filters in the rooms and in the big area, just to filter and clean the air, so that it helps with just scrubbing that air, so that you're not, if you exhale a little water droplet, it gets filtered out in that in the big filter.
Great, great, very good. Well, thank you. I think we have covered everything from soup to nuts here today as best we could in a fairly short amount of time. We could go on, but please do feel free to contact us, Lotus Blossom Clinic. My name is Deb Martine, and thank you to Fee Litzis. Thank you to Jenny. Thank you to Vicki and Dr. David, of course. And I would be remiss if I didn't bring him on for just a moment. You all met Blossom earlier. So that's Blossom. We will be having some additional puppet-related videos, because having some humor in how we learn is an important facet as well. And we'll discuss that more next time. Very good. See you next week. And also for June 7th with Energy Medicine. Thank you, and good evening, good morning, good night from wherever you are.
Thank you.
Bye.
Thank you. Bye.